Welcome everyone to MedSynapse Specialist Podcast series. Today we will be having an important topic to cover: relationship between vitamin D deficiency and fertility. Joining us today to discuss today's topic is Dr. Basema Jaber, Consultant Obstetrician and Gynecologist at Emirates Specialty Hospital in Dubai. Dr. Jaber is passionate about providing a high standard of care to all patients. She has several years of clinical experience in both general obstetrics and gynecology, as well as cosmetic gynecology and gynecological oncology. Welcome, Dr. Basema.
Thank you for this chance.
Thank you so much for being here with us. Let's jump right in. Our audience would like to know whether vitamin D deficiency affects the female fertility. If yes, how?
Yes, all of us know our essential role of vitamin D for our body. And what is more important to know that vitamin D is created in our skin by sunlight. We get only 10% of vitamin D by supplement and food. So sunlight is very important to create vitamin D in our body, and it goes first side to liver to put hydroxy on 25 position, and then to kidney to create 125 hydroxy vitamin D, which is biological vitamin D. There is a lot of receptor discovered in the reproductive system in female. For example, in granulosa cells in ovaries, which we consider it as factory to create the sex hormone. So there is a role of vitamin D to create steroid hormone in ovary. Also, there is a receptor of vitamin D in endometrial cells. So it is essential role for implantation of fertile eggs. Also, even in the placenta, there is a receptor of vitamin D in syncytial trophoblast. So it's a role of vitamin D to regulate the human chorionic gonadotrophin expression and secretion in human syncytial trophoblast, which increase placenta steroid production also. Also, vitamin D is essential to transport calcium in the placenta and stimulation lactogen expression. So a lot of important role in fertility for women. And also it is related to a lot of lesion during reproductive years, like PCO, like dysmenorrhea, like resistance of insulin, even endometriosis. All this disease related to decrease of vitamin D.
Thank you so much, Dr. Basema, for explaining the connection between vitamin D deficiency and female fertility. This shows that how something like vitamin D can influence such important aspect of the reproductive health. Moving on, how do you assess vitamin D levels in patients with fertility concerns?
Okay, usually we can consider sufficient vitamin D is 30 nanogram per mil. But it's preferred to be 40 nanogram per mil to avoid depression, as the deficiency of vitamin D causes depression. We consider that vitamin D insufficient if it is between 20 to 29, but it is decreased if it is less than 20 nanogram per mil. So level of vitamin D must be good before pregnancy and during pregnancy for both gender, male and female, and even before IVF. You know why? Because there is a lot of studies done for يعني know the role of vitamin D in successful of IVF. Anyway, they discovered that successful and outcome of IVF is better between couple which both of them with sufficient level of vitamin D. But it is less successful if level of vitamin D is less. But even this is not fixed, because other study said there is no relationship between success of vitamin D level and successful of IVF. Even in the last ASHRI guideline, they said there is no related. But I think it is better to make our vitamin D is in normal level before we go to do IVF.
Dr. Basema, do you recommend vitamin D supplementation for patients with infertility? If yes, on what dosage and duration?
Yes. And for me, usually I educate the patient to get vitamin D from the sun. As I told you before, vitamin D is created in our skin by sun. Unfortunately, obese woman is not getting enough of vitamin D. You know why? Maybe there is a related between vitamin D and thickness of fat. And there is like close circle between deficiency of vitamin D and obese. If we are obese, we are less vitamin D in our body, and we are less candidate to create vitamin D by sun. We need more hours, more minutes by sunlight to create vitamin D. Or maybe because obese woman not going to sunlight. We know there is a psycho problem with obese woman, especially if there is PCO, hirsutism, try to not appear in popular place. For level of vitamin D, I prefer to know what is our level of vitamin D. Our problem here in our country, all insurance company not cover vitamin D level measurement. If vitamin D is less, we have to get enough, like 50,000 per week. If it is enough, usually I give my pregnant woman 10,000 twice weekly, because they don't even take any sunlight. Here, because hot country, we are more candidate to get deficiency in vitamin D. So as guideline, they said 600 international units under 70 and 800 international unit for people above 70. Of course, because they are more candidate to osteoporosis as deficiency of vitamin D.
Now, when it comes to male fertility, how does vitamin D play a role in sperm health?
Wallahi, there is a long relationship between male fertility and the deficiency of vitamin D. You know why? Because they discovered that male who's less motility of sperm, less quantity of sperm, has deficiency in vitamin D. Maybe because vitamin D is giving power to cyclic AMP, who's making sperm moving. Fertility for male means sperm can motile and go to eggs, which is long away in the fallopian tube, in apart, there is a distance. So this motile need calcium also. This motile need energy, which vitamin D can give to male. Also, there is a relationship, but we don't understand yet, between creating testosterone, which is male hormone, essential male hormone, and deficiency of vitamin D. It's known from research that male with infertility usually has less quantity of vitamin D. And for me, one male, usually if we have less motility, usually we related it with smoking or varicocele. There is one male, there is less motility and there is no varicocele, he is not smoking. When I do vitamin D for him, it was less. And when we give him supplement and educated him how to get vitamin D by sunlight, alhamdulillah, his wife get pregnant and deliver one very beautiful boy. So there is a related, my dear. There is a related. We need calcium for motility. We need vitamin D receptor. Vitamin D is available in tested. So there is a big role between fertility and less vitamin D.
It's amazing to see how vitamin D can affect both men's and women's reproductive health, showing how important it is for fertility. Now, is there evidence supporting the impact of vitamin D on success of assisted reproductive technologies like IVF?
Yes, I think there is a related, but it is controversial, not 100%. But as I said before, there is a related between successful of IVF and between level of vitamin D. Level of vitamin D, if it is good, successful, and outcome will be better. Even there is other research done by Ellison et al. He said there is no related. We don't know, but as I told you, it is better to check from vitamin D level between going to IVF to make sure that we shall successful.
Coming to our next question, are there lifestyle factors that can influence vitamin D levels and fertility?
Yes. Everybody know the role of deficiency of vitamin D in resistance of insulin. You know why? Because when we have deficiency or when we have resistance of insulin, we have less receptor of insulin. We have more insulin level but less receptor. This problem will be more. And everybody know when we have resistance of insulin, we have an imbalance between all hormones. As insulin stimulated androgen more. Androgen is a very toxic environment for follicle. So there is a related between resistance of insulin and infertility. Also, there is a relation between obese and deficiency of vitamin D. As I told you, we don't know which goes other. Maybe deficiency of vitamin D goes obese, or maybe obese goes deficiency of vitamin D. All of them, it is closed circle. All of us know that if we have more fat tissue, that means we have more estrogen, that means we have more hyperplasia and endometrial, we have more problem in infertility. Even when pregnancy happens, obese woman is candidate to miscarriage, is candidate to diabetes, gestational diabetes, preeclampsia. A lot of problems happen between obese women. All of this factor goes, I consider it as risk factor. Other things important also, there is a related between endometriosis, which is very bad disease, and between deficiency of vitamin D. They saw that if we have high level of vitamin D, it will be protect us from endometriosis. Of course, I consider endometriosis as immuno disease. So we have less macrophage, we have less way to defend of ourselves. So also endometriosis is common between infertile women. 50% of women who's going to fertile clinic had almost endometriosis. So when we think about all these bad things, all these things is related to deficiency of vitamin D. Even vitamin D is cause more apoptosis for follicle in the ovary. So it cause less anti-Mullerian hormone because apoptosis is happened more. If we have deficiency of vitamin D, and we have less follicle in age less than 40. You see how much it will be very bad, because even you have enough follicle, if you have deficiency of vitamin D, you will have problem in apoptosis and you will have less reserve, which is very complicated cases to treatment. If we have less reserve, that means we need egg from donor. We couldn't do anything. In that time, FSH will be high and quality of eggs will be less and even quantity of follicle will be less. Even dysmenorrhea. They discover that if we have deficiency of vitamin B, we have primary dysmenorrhea. Maybe because vitamin D, if it is enough, it will be prevent prostaglandin, which is cause dysmenorrhea. It will be make prostaglandin less. So when we thinking about successful of IVF and PCO and endometriosis and ovarian reserve and primary dysmenorrhea, all these bad things come when we have deficiency on vitamin D, which we can take free by sunlight only. 80% to 90% we can take vitamin D from sunlight only, free.
Now, when it comes to excessive vitamin D supplementation, what are the potential risks of taking excessive vitamin D supplements?
You mean if we take more than what we need, is it right?
Yeah, too much vitamin D supplements.
Yes. They said if we take higher than 60,000 international units every day for several months, this causes toxicity. And if its level of vitamin D more than 150 nanogram on milli, that means we are toxic from vitamin D, which is rare to diagnosis. Really, it is rare to diagnosis, but if it has happened, it is very dangerous, toxic, cause vomiting, cause nausea, cause anxiety, and a lot of problem. Usually, even we have sufficient on vitamin D, it's enough to take 50,000 per week to 3 months, and then go to protect, as I told, 10,000 twice weekly. Even pregnant woman couldn't take a long, high dose of vitamin D. It's enough to take 10,000 twice weekly, even there is deficiency. But if we take it from sunlight, and there is something to tell you about what is how the way to get vitamin D. We need more skin, without clouds. You understand me? Even window, we have to open window. We have to sit with more skin square of our body to get vitamin D. 15 minutes, 3 times per week is enough. But if look, in Africa, they need more. It's obese, they need more minutes. You understand me? And also there is a lot of food like milk and everything, the product from milk, egg, fish, salmon, and liver. All of this is rich of vitamin D. But all this, even nutrition supplement, give us only 10% of what we need from vitamin D. We need sunlight, my dear.
This shows how important it is to work close with doctors to figure out the right amount of supplements including the nutrition and supplementation. Now, moving on to the next question. Are there any other factors to consider when recommending vitamin D supplementation for fertility?
As I told you, when they do IVF, they usually do a lot of tests. Even vitamin D, they do vitamin D. When we have polycystic ovary, resistant of insulin, dysmenorrhea, endometriosis, even fibroids, level of vitamin D is less with those people, which means there is a relationship between deficiency of vitamin D and this lesion. And before, our old family always said something important: if there is a son in the house, there is no way or no space for doctors. Really, you know why? Because if there is sun, that means there is no doctor, because there is no deficiency of vitamin D. My dear, our lifestyle now, we are working indoor. We don't go to see the sun. We are not doing any working, any exercise. All these things, sitting on the chair all the time, all these things, even they make us relief in some condition, but it causes a lot of lesion, which make us must be aware of it. We must take care of our health, because if we are walking, it is better to protect ourselves from a lot of lesion. Chair is very bad. Eating sugar is very bad. Not doing exercise is very bad. Our lifestyle, our food, our sitting, our stress, even stress, stress is very bad, because if we have stress, that means we have more cortisol. That means we have more sugar, more resistant of insulin. All this disease related, which is each other, and all this disease, if we get good lifestyle, we avoid all of this disease, even cancer. Immunization is important, and by our immunization, we can avoid a lot of lesion. Even corona, corona, they called corona is disease of deficiency vitamin D, because when corona comes to a person who's have enough vitamin D, he will resistance, and maybe he will get it and free from it, and even him don't know. But deficiency of vitamin D, people with disease with immunization like rheumatoid, SLE, a lot of disease related to immunization problem, all of this is related to vitamin D. That's why I consider vitamin D is not only vitamin, it is hormone steroid. It's important, my dear, to all our cells, because they thought in the past it is only for bone, to avoid osteoporosis, as cause calcium come to bone. It's not only that. It's related to our reproductive job also. It's related to immunization system. If we have enough of vitamin D, we avoid cancer, we avoid immunization lesion, which is same like cancer. It's chronic disease. So our rule now to make, now even children now stay on laptop all the day. We have push them to play football outside to create more bone stone. All of these things is important, my dear. We have to educate the populace to how much these things cause problem to our health.
Thank you so much, Dr. Basema, for sharing your expert insights on vitamin D and its impact on fertility. It's been a very enlightening and interesting conversation today.
Thank you.
And a big thank you to our viewers for joining us. Remember, this podcast was brought to you by MedSynapse, where medical professionals connect, discuss, and collaborate globally. Be sure to become an active member on our MedSynapse platform to engage with doctors from around the world, exchange knowledge, and continue learning together. Until next time, goodbye and take care. you.